Hi everyone, my name is Sophia Weiss. I'm a nurse practitioner. I work with neurosurgical practice and also the founder of Re.Wellness. I hope you're doing well today, and I'm going to go over just a typical back pain workup that includes typically x-rays, physical therapy, sometimes an MRI with a follow-up with pain management and surgery if it's indicated. History and physical usually entails questions regarding when your pain started, if there was any preceding injury or trauma, did it suddenly get worse or did it gradually get worse over time, what makes your pain better, what makes it worse, what kind of pain is it, can you describe it, is it sharp, aching, dull, throbbing, does it radiate anywhere? If you could rate it on a scale of 0 to 10, 10 being the worst pain you've ever had, what would it be? With the exam, we're typically looking at the contour of your spine, palpating your musculature, looking at your range of motion, doing a motor, muscle kind of sensory and reflex exam. Also trying to do some provocative tests by eliciting pain with specific maneuvers. Typical causes of back pain are muscle ligament strain, bulging, herniated discs, arthritis, osteoporosis, scoliosis, infection, fractures. X-rays are usually the most inexpensive and quickest way to look at the spine. We typically try to look for alignment and any kind of degenerative changes, such as in the disc space, the facet joints, looking for if there's any kind of spondylolisthesis, meaning the vertebral bodies are misaligned, any kind of scoliosis, fractures, if they've had any previous surgeries, fusions, looking at the hardware. I typically recommend regular low-impact aerobic exercise and core strengthening. Try to reinforce proper body mechanics. I'm always encouraging a healthy weight and smoking cessation. Some of our surgeons won't even offer surgery if the patient's using nicotine products because it's linked with poor bone healing. Initial management treatment usually entails over-the-counter NSAIDs, Tylenol, topical pain relievers, heat-cold therapy, TENS units, the deep tissue massage guns, chiropractic care, massage, yoga, acupuncture. Typical initial management is physical therapy. Usually it's at least 6 weeks. And most insurance companies want to make sure that you've done this before even obtaining an MRI because a majority of people do respond to physical therapy and conservative management. If you're unresponsive to physical therapy, then most likely an MRI is indicated. Usually it's without contrast unless you're concerned for some sort of mass or infection. You have to check out this article. It's really great. It's how to easily read an MRI. And essentially this is just looking at the alignment and displaying what spondylolisthesis looks like with the misalignment of the vertebral body. These are certain axial views that are really great for showing the degree of narrowing in the central canal and where the nerve roots exit. It's nice because it shows you kind of the different definitions of where the disc herniation is. I know I see a lot of patients that come in and they're worried because they have, disc bulges, and it really depends on where they're at and to what degree they're impinging. This is a great slide that shows a normal central canal. Everything looks real happy there, and then it's compared to a severe narrowing of that central canal. And this is usually what we consider lumbar stenosis. Obviously, the B diagram is a very severe scenario, but it's usually attributed to a combination, disc herniation, thickening of ligaments and bone. Pain management's usually always worthwhile. They can escalate your medications to muscle relaxants, narcotics, nerve pain medication. They can do trigger point injections, epidural steroid injections, radiofrequency ablations, spinal cord stimulator placements. Usually surgery is reserved for people that have been unresponsive to conservative management. They have some sort of debilitating symptom, such as extreme leg pain that debilitates their kind of quality of life and normal daily activities. Any progressive neurologic conditions with leg weakness or to the extreme of any loss of bowel or bladder function, difficulty ambulating. This picture is actually a picture of one of the surgeons I work with, Dr. Kram Moon, so thank you for letting me include that. Again, I think this is a great article. It's, I think, very easy for kind of a layman person to look at the MRI and kind of get an idea of what's normal and not normal. So I included the link there, so hopefully you can check it out. I sincerely hope you found value in this video, and I hope that if you're experiencing back pain, that this gives you a good framework on what to expect for your potential workup. Obviously, every provider is a little bit different, but hopefully you can educate yourself and kind of know what your options are. I wish you well.